Hey, what's up guys, it's me, the PsychiatryNPDavidC. You ever wonder what a typical day is like for a psych nurse practitioner? There isn't actually like a typical day, because there's a lot of unusual things that can happen throughout the day. Now this is going to be more outpatient focused. It's going to be for like those clinics that are open Monday through Friday, or even just telehealth sessions. I'm going to cover the overall structure of the day, the mix of patients you can get, how much charting there is, and just the pros and cons of being a psych NP. Let's talk about it. So I like to usually arrive at the clinic and set up about 15 minutes before my first appointment. I spend those 15 minutes looking at all the clients I have scheduled for the day. I'll check if I have any new messages, any new lab results, pretty much just mentally preparing for the day. Because once that first appointment starts, it's pretty much non-stop work throughout the rest of the day. If you're working a W-2 job, you usually have set hours like from 9 a.m. to 5 p.m. But if you're a 1099 independent contractor, you can actually set your own schedule, which is nice. But anyway, the way I have it set up is I have 30 minutes for follow-ups and 60 minutes for intakes. Follow-ups are returning clients who you've seen before, and intakes are completely new patients you haven't seen before. Most of your visits are gonna be follow-ups, but there are gonna be a few new intakes here and there. And even though I have a certain amount of time set for each type of visit, each visit can actually vary in time by a lot, depending on the complexity of the patient. So let's say we have a new 65-year-old female patient with a lot of comorbid medical conditions like diabetes, hypertension, seizures. And she also has a lot of psychiatric complaints like depression, anxiety, PTSD, OCD. Then you can imagine that intake is probably going to take the whole 60 minutes, if not longer. But if I encounter a new patient who's like 22-year-old female, no medical history, just here for mild anxiety, that intake probably isn't going to take the full 60 minutes. And the same thing goes for follow-ups. A follow-up for a patient who's unstable and who needs constant medication management and even therapy, their follow-up is going to take a lot longer than another patient who, let's say, is just on like one medication for depression and that's it. So yeah, depending on the population you're treating, each patient visit is going to vary in time by a lot. As a W-2 employee, you're probably going to want the simpler cases since you're getting paid a set rate hourly. But as an independent contractor, you actually bill services yourself. So if you take longer with the patient, you can actually bill for like a higher payout. So there are definitely pros and cons between doing W-2 and independent contractor. Now, if you're working in person, chances are some of your patients will come in person while others will just be telehealth. So if you're working in person, the EMR usually has an option to show when the patient arrives in the lobby. So you'll know when you can go get them and bring them back to your office. And if you're doing telehealth, you just log in at the video link at the appointment time. And then during the appointment itself, you're doing the usual things like assessing, diagnosing, seeing if they have any side effects, any other concerns they may be having. If you're doing therapy, you could do therapy as well. The time each visit takes also kind of depends on what kind of provider you are. If you're someone who wants to be like quick, efficient, just boom, 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 then your appointments are going to be a lot quicker than another provider who wants to ask like every single thorough question. I'm not saying one way is better than the other, but there are definitely differences in providers in that fashion. If you have a new patient who's coming, usually they'll have filled out like a pre-intake form where they describe their chief complaint, like what they're looking for. And they'll also have filled out the PHQ-9 and the GAD-7, which lets you know their depression and anxiety scores. So you can kind of research them before you actually see them. For follow-ups, I just review my previous notes from the last session. It doesn't take very long, probably like 2 minutes or maybe 5 minutes if it's a more complex case. So yeah, you're pretty much doing all the follow-ups and intakes that are scheduled on your schedule for the day. At the end of each visit, I'll go over like any new prescriptions they may have or when they're going to see me next, and then just answer any questions they may have before they go. So you would think that that's all you have to do, right? Like just see your patients on each time block and that's it. But there's actually a whole lot of in-between stuff you got to do. Like for example, a patient may send a message to the clinic saying they're unable to pick up their prescription for whatever reason. Maybe their insurance doesn't cover it or something. And then you got to find out which other medication is suitable replacement that is covered by their insurance. And then you got to contact them and let them know about it. Or like a prescription refill request is faxed to the office that you got to sign and fax back to the pharmacy. Some patients may want like disability forms or excuse forms, school absence forms. If you're working on a complex patient, you're probably going to want to collaborate with like the therapist and your collaborating psychiatrist. Sometimes there are going to be patients where you just don't know what to do regarding their medications. Like they've tried almost everything. They don't seem to be getting any better. So you really spend a lot of time outside the designated appointment time for that patient, just thinking about how you can treat them effectively. And a lot of the filler time is also used for just finishing up documentation and charting. Let's say you get 60 minutes for a new intake, right? But you spend the whole 60 minutes talking to the patient. That means you'll have to spend extra time outside of those 60 minutes to do the charting. And that charting on a new patient is gonna take a long time, especially if you're new. So if you have like gaps in between appointments, you're spending a lot of time just catching up on charting on your previous patients that you've seen earlier. It happens almost every day where I haven't finished charting on my current patient before I have to see my next one, so I have to go back and finish charting later on. So that's why you never actually stop working at the end of your shift. Like, let's say, for example, you work 9 to 5, right? And then you see your last follow-up from 4:30 to 5 p.m. When 5 p.m. hits, you're probably gonna still have to catch up on charting on all your other patients that day. I mean, unless you're like a seasoned veteran who's like super fast. And then I find that a lot of times it's actually kind of difficult to leave work at work. Like sometimes I'll be caring for a complex patient and then I go home and I'll still be thinking about what I could have done better or like which med change I could have done instead. I really try not to take work home with me, but sometimes the thoughts are just kind of there. So you really need to find things to do outside of work to keep that work-life balance. Like going to the gym, doing some hobbies, hanging out with friends, stuff like that. If you're working in person, sometimes there's like pharmacy reps who will bring lunch for everybody at your clinic because they're trying to like sell you on this new drug that they're making. Like they want you to prescribe their new drug to your patients so they make more money off of it. Yeah, it's kind of messed up, but you do get free lunch, so. If you're doing telehealth, you have a lot more freedom during downtime. Like for example, if I have downtime, I'll just like play a video game for a few minutes here and there. Or if I have like a 1 hour or 2 hour break, I'll even go to the gym. So working in person versus telehealth has their own pros and cons. So let's sum up the gist of outpatient psych NP work. You get a lot of autonomy in that you do your own thing. Like you'll have your own office, you make your own decisions. You don't really have a boss telling you what to do. You're gonna have long-term relationships with clients because they're gonna come back like every 2 weeks, 4 weeks, 8 weeks, whatever. It's very rewarding when you see that they make good progress over time, especially when you're the first provider they've seen. But it's also challenging and discouraging when you see a patient who's like deteriorating under your care. So you gotta be prepared for that because you're gonna feel like a failure sometimes. I have one patient with like borderline personality disorder, bipolar disorder, ADHD, depression, anxiety, and I just pretty much have like no idea what to do with her. I discuss her case with my collaborating psychiatrist every month to see what he would do. But honestly, that's just part of the job. You're not going to know exactly what to do for every single patient. All you can do is try your best, right? So even though it seems pretty routine-like, you just see this patient at this time slot and then this patient at this time slot, there's actually a lot of unpredictability. Some days you'll finish early and get to leave work on time, while other days you finish late and just take work home with you. But as you gain more experience, that should happen less often. So to wrap it all up, in a sense, there's no really a typical day for an NP. Every day is like a little bit different with twists and turns that you don't see coming. But when you see improvements in your patients that you've been treating since day one, that's what makes it rewarding. If you have any questions regarding a typical day as a psych NP, let me know in the comments down below. If you found this video helpful, make sure to like and subscribe. I am also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. And with that, your mental health just leveled up. You're welcome.